Hi, welcome to my channel. Thank you for vibing with me here at Stethoscope and Stilettos. I am Dr. Hall. Okay, so today we're going to be talking about uterine fibroids. This topic is very close to home for me. It's close to my heart because I know a lot of females that suffer from this condition. And in my time in practice, I've seen many women come in with uterine fibroids, and it could be a very debilitating, it can be a very life altering condition when the symptoms get very severe. So I just wanted to just chat a bit about it and help bring awareness, because there's some females that don't even know about uterine fibroids. They have never even heard about it, and it's such a very common condition. Okay, so let's get into this. So, uterine fibroids. First of all, what even is a uterus? Before we talk about what are the fibroids. So, a uterus looks like this, and it actually has the shape of an upside down pear. Fun fact. So, the uterus is basically a part of the female reproductive system. It's like a cavity, is where the baby is housed for the 9 months until it's fully developed, until it's ready to be delivered. Uterine fibroids, also known as leiomyomas, they are growths made up of muscles and connective tissues in the walls of the uterus. Okay, so they can be found inside the uterus in that cavity, or they can be found on the uterus outside. There are various types of classifications of these fibroids based on their locations that we will not get into in this video. However, it's very important to know that this is the most common non-cancerous or benign tumor that women experience. It also has a very high incidence in black women, in black females. Just being black is a risk factor. Okay, let's get into causes and risk factors. Generally, the cause of uterine fibroids are not known. However, they are predisposing factors such as your menarche or early onset of your menstrual period. Women who would have started seeing their period at a very early age, you usually see it between the age of 9 and 13. However, if you've really started seeing your period very early, that's one risk factor of developing uterine fibroids. Obesity. If you have about 20% over your normal, what's considered your normal body weight, you are at risk of having uterine fibroids. Estrogen levels being elevated. There are conditions such as pregnancy that can cause estrogen levels to be elevated. And the thing is, fibroids, they feed on estrogen, okay? Estrogen is a hormone that is very high in females, especially during their reproductive age. And generally, during your reproductive age, you are at risk of having uterine fibroids. Interesting point to note as well, just as estrogen levels elevated increases your risk when the levels are lower, such as in menopause, the fibroids actually shrink. Okay, so as you age, as you get older, your chances of having fibroids actually decreases. Let's get into symptoms. Most females do not experience any symptoms with this condition. That's why many women are like walking around unaware of the fact that they may have uterine fibroids. Okay, among the symptoms, we have abnormal vaginal bleeding. You have excessive or painful bleeding during your menstrual cycle, which can eventually lead to iron deficiency. You can have this feeling of fullness or discomfort in your lower abdomen. Diagnosis and treatment. How do you diagnose the fibroids? Like, how do you know that you have uterine fibroids? So you've been experiencing these symptoms, the heavy bleeding, the abdominal discomfort. So you go to your doctor, and what they're going to do is called an abdominal ultrasound. You may have pelvic exams and abdominal ultrasounds done, and these are the ways how you would detect the fibroids in the uterus. And moving forward, management would entail periodic visits with your doctor to closely monitor the size of these fibroids. Generally, the management is a case by case basis. Everyone is going to have a different type of management based on the size and location of the fibroids that they may have. Also, it will depend on their age, if they, it's still a woman in a reproductive age, if she wants to have children in the future, versus someone in menopause that does not desire, any children or anything. So they may have what you call an hysterectomy, where you completely remove the uterus, versus women who are still in their reproductive age who would desire children in the future. They would have what you call a myomectomy. That's where you just remove surgically the fibroids themselves one by one from the uterus. If you would have had vaginal bleeding, excessive bleeding, that you have iron deficiency, anemia, you would need to have treatment specifically for this anemia. So just remember, the fibroids, uterine fibroids, are very common, and some women may have symptoms while some may have no symptoms at all. And it's perfectly treatable, and it's something that you should not overly stress about. Can this condition affect fertility? Yes, it can. As I mentioned earlier, the fibroids, they're in the cavity of the uterus, basically competing with any pregnancy that may be in there. So in terms of fertility, it could inhibit the path of the sperms and the eggs being able to fertilize in there. It can inhibit implantation in the lining of the uterus, and it can also inhibit growth of the baby, of the fetus, because the space is just going to be too small for both the fibroid and the growing fetus. So yes, fertility can be affected, as well as the duration of a pregnancy. Can fibroids be prevented? Prevention of uterine fibroids may not be possible. However, there are things that we can do in order to not be in such situations, such as eating a healthy diet, exercising, and just having an overall healthy lifestyle could actually reduce your risk of having uterine fibroids. So remember, uterine fibroids is a very common condition that many women experience throughout their life. It can have no symptoms, and it can have very severe symptoms. What's important is to make sure you live a healthy lifestyle and have regular checks with your doctor to stay on top of this condition. If you've made it this far to the end of my video, thank you so much for watching. If you enjoyed, please like and subscribe to my channel. And I really hope that you're going away leaving much better than when you started this video. And I hope that you would have learned something that will help you. Please share the information, and just remember, we need to feel good and look good. Thank you for joining me here at Stethoscope and Stilettos. Until next time, bye.